Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today is Dr. Girma Tefera, who of course is the Medical Director of Operation Giving Back at the ACS. Welcome back, Dr. Tefera.
Thank you, Dr. Watson.
Great to have you here again. Last time we spoke about the awardees of the Pfizer Humanitarian Awards during the 2021 annual virtual Clinical Congress of the American College of Surgeons that were distributed to the Board of Governors. And we very briefly touched upon a subject upon which I'd like to expand today, specifically the activities in Africa that have begun and burgeoned under your leadership. So perhaps we could start out, tell us a little bit about what was the impetus to get those programs up and going in Africa.
Absolutely. I'm delighted to give you some insights as to what really led to that and then how we have been doing over the past couple of years. Clearly, in the American College of Surgeons members in general, there is a lot of individuals who are actually eager to provide volunteer work, domestic and international. Although statistically speaking, probably about 70% are more inclined in the international realm. But what we found out in a survey that we did in 2015 was that there is a lot of work that our individual fellow members are doing, but these efforts were not coordinated. And so one of the issues that, or questions that was raised at that time was, it's one thing to go to a place and do a month or a week and then return in about a year. So you can't really change, the situation much. And so at the American College, Board of Regents meeting in, I think it was in 2016, February, under the leadership of the chair at that time was Dr. Valerie Rouge. She said, we need to have some kind of a global engagement strategy. And so that's how then we started thinking about, we need to really develop programmatic activities that the ACS can develop, that Operation Giving Back can lead, so that we can then create an environment where people can join hands and develop global surgical training centers or hubs that can be a lot more meaningful in terms of infrastructure development, rather than parachuting in and parachuting out. And so that's how the genesis of this is. And since then, we have done Ethiopia, and now we are actually working in Zambia, and we are also off a good start to do some work in Rwanda.
So perhaps since Ethiopia is the most developed, you've of course emphasized the importance of sustainability rather than the hit and run approach. What is it that the ACS has invested in Ethiopia that makes it sustainable?
Yeah, so great question. And, sustainability has to always be the most important and essential question when you start any global health work, because otherwise, whatever you do disappears after a year or two. So with that in mind, what we actually did at the beginning was created, first of all, a survey to assess different institutions in what we call the COSECSA region. The COSECSA region is actually the region that has about 14 countries on the Eastern, Central, and Southern Africa. And this is a sister college, basically, that is in that region. And out of this survey, we identified 3 places that we thought would be a good place to start our initial infrastructure development and this sustainable infrastructure development. And the Hawassa University Hospital stood up to the committee for this initiative. That said, I think the main ingredient that is making it sustainable right now is that the stakeholders that are participating in this are the ACS in creating the platform, about 13 US academic institutions who are really volunteering, the surgeons and the residents and the educators, the Ethiopian Ministry of Health, who is one of the major stakeholders. And the University Hospital in Awasa actually participating in this by actually having a skin in the game, right? So by providing local logistics, housing, and opening up their institution for our volunteers. So it became all of a sudden a shared responsibility amongst all of us. And so we decide on what needs to be done together. We decide on the goals together. And this shared responsibility model is really leading us to take to heart what the priority of the host institution is. Therefore, with that, we go to the next step, which is obviously it will sustain itself because this is actually part of their plan, their priority. It's not something we are taking as our plan is set, but together we have a shared goal. So I think that's the ingredient we have to make this sustainable, and it's working well.
You've done some phenomenal work, certainly, and the fact that it's going to be reproduced for the moment in 2 other countries, and ultimately, I'm sure, in many more countries throughout the COSECSA region, and maybe even in West Africa, maybe even elsewhere in the world. But I'm not sure that all of our viewers and listeners are familiar with what the IT is. Is it bricks and mortar? Is it a lab? Is it, well, maybe you can just give us a better perspective on the IT.
Yes, absolutely. I think, that it is pretty much like having boots on the ground kind of it, right? So whereby surgeons from 13 academic institutions will continuously rotate and travel to Hawassa so that they are physically present there to be engaged in the clinical care, in the surgical education, in the trauma care, trauma education, and all the activities that we know of in surgical teaching. But not only that, but also develop activities around research, because at the end of the day, research is really the glue that is going to keep an academic institution to thrive. And so we have some investment around that. Together, we are working also to build not only the classrooms, but also the operating rooms. There is a lot of need to actually develop the infrastructures in the operating room, like bringing materials. But most importantly, there are skills that can be transferred. Just a typical example might be laparoscopic cholecystectomy or some basic vascular surgery procedures, things that they don't have that could easily learn and do it. So that it basically involves taking that clinical care, that surgical education, that research, introducing quality measures, because without including quality measures, we cannot improve on what we do. And so we try to measure some of the work that is being done in terms of outcomes so that we can improve upon it. So it's really a very comprehensive one from that perspective. And we are now looking to expand it so that we can get the entire surgical ecosystem. We need anesthesia now to come on board. So we have actually anesthesiologists interested in joining us with this effort. So it has become a model where joining hands can really make a long-term and a quick, actually effective improvement in the care that is needed.
That's great. I'm glad you've elucidated that it's basically people being there on a continuous basis, educating, as well as helping to equip operating rooms so the procedures can go on. The follow-on questions would be, if a surgeon, somebody watching us, listening to us today, wants to participate, wants to go to Ethiopia and spend some time, but they're not a faculty member at one of these 13 universities in the consortium, can they participate, and how would they go about doing it?
Oh yeah, there is actually possibility to participate, and they just need to reach out to Operation Giving Back. If you just go to the website and click contact us and send us an email, we'll reach out to them. There is actually ample opportunities. It's not only the 13 institutions, but there is really a lot more work to do. As you can imagine, the subspecialties are the next frontiers that we have to engage. Without a subspecialty growth, only with a general surgical approach, there is so much you can do. And so we welcome actually any surgeon of any specialty for that matter to give us a call, and we'll find ways to engage.
That's great. And then the second question is, if somebody who's in training wanted to participate in the educational process, somebody who's a resident or fellow, they want to use their vacation time, can they participate?
For the residents, we highly encourage for them to be part of the participating institutions, because if we open this to non-participating institutions, we will open up the Pandora's box. So we cannot really control this. So we want it to also be, the carrot, if you will, to participate in this kind of activities. At the end of the day, it's really to provide our learners this opportunity to come and be in that incredible space where they can definitely have a lot of, testing challenges, which can lead to them thinking about solutions, innovative solutions. And I think the earlier they engage, the more innovative they can become, actually, to find some solutions to the common problems. And so I would encourage highly residents' participation, but I really want actually the departments to raise their hands first.
That's great. And speaking of the learners, you and I are speaking to each other between the Midwest, the upper Midwest, and the extreme Southeast by video. Our learners from Operation Giving Back or Hawassa University in Ethiopia, are they now actively participating in college educational activities, encouraged to do so as part of the curriculum?
Yeah, great question. And in fact, the COVID has taught all of us in many ways to be creative, right, how to engage. And in fact, the Hawassa Collaborative, one of the things they have done is they have done several weeks of research methodology course over Zoom, basically having that course given Saturday mornings. We have done, I think, 5 or 6 team course trainings actually over Zoom at different institutions, both in Hawassa and outside Hawassa. We have, with the program in Lusaka, participating in their journal clubs, which happens every Friday. We have actually provided them access to JAX so that they could really use some of those articles from JAX as well. We are participating in the didactic programs that happen on a weekly basis in Hawassa from, for a long time now, and M&M conferences as well. So yeah, so we are engaged, and that engagement continues. And actually our partners are really looking forward to people going back and have that in-person presence, which really means a lot. And there is a lot more to do actually when you are in person, elbow to elbow in the operating room. So everybody's looking forward to those times coming back. And I hope we'll learn to live with COVID and get to the next step pretty soon.
Yeah, I think we certainly all do. We all long for that elbow to elbow personal contact. And just when we started getting close, things changed again. So let's hope they change back. Well, again, I commend you on the fantastic work you're doing. Leave you with the last few moments if you have any additional comments you'd like to make about the program.
Yeah, I really thank you for this opportunity. And I just want to the audience to know that subspecialty related activities are also really, really welcome. We are focusing on cardiothoracic and vascular surgery program in Rwanda that's coming up, and I would appreciate cardiothoracic surgeons who may want to participate and volunteer in this realm. We would really welcome from plastic surgery as well as trauma and critical care. So any specialty actually in surgery is welcome, and I would really appreciate if we can be contacted by email, and we will definitely respond to them and use their expertise to make to make surgery really part of this public health and surgery, if you will, in low-income countries. And thank you for the opportunity again.
Well, thank you again and congratulations on a wonderful program. I'm looking forward to watching its continued growth and expansion, both in depth where it's already established and in breadth as it travels to other places.